Dr. Gauner, let me start with you. I walked in, we've never met. I reached out to shake your hand, and you said, I'm not shaking hands anymore. Tell me, this is a story that really transcends what we usually cover here, which is the White House, the abnormal nature of this presidency, the norm busting, and that's why the information lockdown is where we start. But I think what's on most people's minds is how do they protect themselves and their families?
Well, I do think we need to start changing certain habits like shaking hands.
No more shaking hands.
No more shaking hands. I mean, as I said to some of these other folks, you know, I don't mind hugging, actually, but shaking hands, definitely not, because that's how you spread germs, and then you touch your face and you rub your eye and so on.
I want to get a pen and write this down. I trust that someone that works here will take this down. Okay.
I think some of the other very easy common sense things, I would have an alcohol-based hand sanitizer on you at all times.
Is that like Purell?
Yeah, like Purell. Yeah, okay. There's other brands, too. I think another thing that may happen in the not-too-distant future, and we're already seeing some issues with supply chains, a lot of the ingredients in our drugs come from China if they're not fully manufactured in China. I would reach out to your healthcare provider and ask if you are on chronic medications for refills, maybe 90 days instead of 30 days. Make sure you have access to that in case you need it.
Let me ask you two more things that are not political in nature. They're just people in their lives. Two people to me said, Amazon's out of masks. Another person said, I'm flying cross country and I can't find a mask. Do masks help?
So there's really two kinds of masks. There's the surgical mask that we put on patients who have symptoms, and that really is meant to trap the droplets that you cough and sneeze out. So it's really to prevent transmission to other people. And then you have what are called N95 masks. So those are the respirators that we use in the hospital. But you have to remember, our exposure is very different. You know, when I go see a patient in the Bellevue emergency department, they may have soiled their sheets. I'm listening to them, and you talk about Dr. Lee, the ophthalmologist. He was literally up in somebody's face examining their eyes, right? That's a very different dose of exposure.
So we've started with the risk because I really believe, and if anyone disagrees with me, please jump in. I think this is now not a political story. This is a national health crisis. This is something that has people feeling even more anxiety than they do about politics. But let me ask you about the politics. I mean, the White House locking down someone like Anthony Fauci. He worked, in full disclosure, he worked during the Bush presidency in which I served. He worked on the preparations, and I was part of the team that prepared for the bird flu, a pandemic outbreak. I know he worked for Democratic and Republican presidents. I'm not sure he has ever been constrained in terms of being able to speak about public health issues. Does that worry you?
I'm extremely concerned because that means that the White House is not listening to its best scientists. They're more concerned about political messaging. You know, Fauci has served under Ronald Reagan, both Bushes, and was never prevented from speaking out in this way. You know, back during the HIV epidemic, he was able to say what he needed to say to bring that under control.
Mm-hmm. You know, Bob Costa, you've got a story out at the beginning of the week that almost didn't predict this exact sequence of events, but put, in black and white, the degree to which Donald Trump is relying on the strength of the stock market for his own reelection. What are you hearing from the White House about how they thought last night looked, the optics of disagreeing with health experts, standing shoulder to shoulder with the president, and then today's effort to bottleneck information, push it all through Mike Pence?
There has been deep concern for days, talking to White House officials and confidants of President Trump. It's clear that the Dow Jones Industrial Average and the NASDAQ and other indicators are part of the re-election campaign. And what they wanted to do is not only get control of this in terms of what's happening on the health front, but the political front, and putting Vice President Pence in charge, to use President Trump's words. It's about making sure there's one messenger for this administration. Regardless of all the criticism they're facing from health professionals about that decision, they felt like politically and from a management point, they wanted to make sure that the White House is in control. But they're already seeing tensions in day one, less than 24 hours after that news conference. And there are tensions inside the White House about whether Vice President Pence is prepared for the onslaught of criticism about him being the head.
You know, Bob Costa, the other thing that came to my mind is this is a moment of choosing for Mike Pence. It seems like he can go down the path that Jim Mattis went, where he resigned when there was a policy in Syria he disagreed with, or Don McGahn, who tried to do his job and as a conservative legal activist install conservative justices, but when it came to cooperating or respecting Robert Mueller, he spent more than 30 hours answering questions to him, or he can do what so many other people in that West Wing do, Kellyanne Conway, all the people that fall in line and seem to revert to Trumpism, which includes lies and distortions and smears. Any sense of where the Pence world is in terms of the high wire act this represents for his political future?
I've closely covered Vice President Pence for years and in recent months been on the road with him and others in his circle. It's clear that he is a loyalist. Yesterday, he's a loyalist. Today, he is lockstep with President Trump on every part of this response. And part of putting him in, his allies tell me, is there was concern in the president's inner circle about Secretary Azar. Was he someone who would get out on a limb, not just Dr. Fauci, but Secretary Azar himself?
That, David Jolly, is the most disconcerting thing I've heard in a week of disconcerting news. That, and Bob Costin knows this West Wing, he knows this circle around Mike Pence, that he wants the world to know today of all days he is a loyalist is a scary thought.
Bob's right. Mike Pence can not be trusted any more than Donald Trump can. Donald Trump is going to endanger American lives for reasons of his personal ego and his political fortunes. What Donald Trump should have said to the nation yesterday is, we believe the coronavirus poses a global health risk for which the United States is prepared. And as president, I have marshaled all of the resources of the United States government to address both the spread of it as well as the research response to it. And as president, I'm asking the American people to do their part, to engage in certain behaviors, washing of hands and so forth, that you would typically ask your family to do when there is a health risk. Donald Trump didn't do that. And I think what the nation sees in Donald Trump in moments like this is someone who is always on the defensive, seeming to carry the burden of his own personal brand, not the burden of a nation that is fearful. Donald Trump's predecessors understood when the nation felt fear. If it was around a shooting, a death, a national catastrophe, they had an empathy. And they understood fear and how to address it. Yes, expressing the confidence of the nation and saying we have marshaled the resources necessary, but realistically understanding the anxiety of the American people. Donald Trump refuses to recognize that fear. And there's going to be a growing chasm between what Donald Trump and Mike Pence have to say about coronavirus and what the American people feel about it. And the frustration you're seeing increase with the president is where his political liability is going to increase between now and November.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.